I'm a long-term ventilated educator, so I teach families, carers, nurses, doctors how to safely look after children with long-term ventilation needs. The charity make a big difference to help us with our long-term ventilator patients because they fund our youth workers.
When you come to the hospital as a family, and particularly if you're not sure how long your child's going to be here, it can be really scary. And it feels like you're handing over your child's life to these professionals, and this isn't a normal thing for you. But it is a normal thing to these doctors and nurses. They do it day in, day out. They save so many children and help so many families. And I think the biggest thing that helped was the kindness and the care that these doctors and nurses and the play therapists gave us all as a family. And they continued as best they could to try and make everything seem as normal as possible for George. And that was really important.
My journey at the hospital started when 3 paramedics knocked on my door. I was rushed to North Manchester General. I spent almost a month in ICU where my organs started failing one by one, and it was a result of a cocktail of COVID and multiple strains of malaria which I caught while I was on holiday, then an autoimmune disorder called HLH. I spent in total almost 8 weeks in hospital.
So I was born in St Mary's Hospital in 1991, and I was born with a rare blood disorder called beta thalassemia major. It basically means that I have to have blood transfusions every 3 weeks or so. I think that my experience being a patient, but also my familiarity with the hospitals, has really sort of lent itself to me having the sort of greatest impact I can from within my role. I really love that I get to help support the things like the youth service. They support the well-being of young people who are in hospital for long periods or who are in quite frequently. In particular, they have a sort of transition service which helps young people move from children's services into adult services, and they have a specialist who does this for children with thalassemia and sickle cell, which is something that wasn't around when I was moving into adult services. So I love being able to kind of help give that to next generations.
I think it's really important that people support the charity. The doctors and nurses, they're looking after the child, trying to get them better, but it's the donations and the supporters that are allowing a child to be in the hospital and have as much fun and as much laughter and as much childlike behaviour as possible in a really tough time.
I think it's really important for people to support the charity because the extra funding that the hospitals can get to give that extra bit of care and attention to the people who need it the most when they need it. I didn't know I'd need it. I was fine until I wasn't. And I think it's only in those moments when it's that extra bit of attention, care that really helps.
We work really closely with the youth service team for all of our children, whether it be to do trips or to get them into sessions that they wouldn't normally be able to in if they're missing schooling and sensory and stuff. Our youth service do all of that with our children, and without the charities, we wouldn't be able to do any of that. Given them and shown them that they can do anything that anybody else can do just because children have disabilities, they can still be children, and without our youth service, we would never have been able to do that. So thanks to the charities.
When you support our charity, you help to support the patients for who the hospital is like a second home. You help to support the staff for who patients will never forget because they help them through some of the toughest parts of their life. And you help support the research that means children with conditions like mine live longer and happier lives.